September is Blood Cancer Awareness Month. Did you know that 20% of all the cancers diagnosed worldwide and in India are blood cancers? The deadliest form of this blood cancer is leukemia. Chances are that you or someone you know may be diagnosed with blood cancer. Now, if you've watched me here on YouTube before, then welcome back. But if you are new to my channel, then welcome. I'm Dr. Smrita Singh and I'm an MD and wellness expert. In this video, I'm going to talk about blood cancers, specifically leukemias. So what is blood cancer? Our blood contains various types of cells. In just one drop, there are nearly 500,000 white blood cells and over 200 million red blood cells. To maintain these levels, our bodies continuously recycle old cells and produce new ones. This process occurs in the bone marrow, which houses stem cells responsible for generating all blood cells. Stem cells can divide multiple times, creating copies that develop into different blood cells. Red blood cells transport oxygen, while white blood cells combat infections and protect against cancer. For cells to grow and specialize properly, the genome must remain healthy and intact. However, DNA errors can occur, and when they accumulate, they can cause cells to grow uncontrollably, leading to leukemia or lymphoma. For instance, errors in lymphoblasts result in acute lymphoblastic leukemia or ALL, the most common leukemia in children. Since these cancers originate from faulty blood cells, they don't form solid tumors but circulate in the bloodstream. This means surgery alone can't remove leukemia or lymphoma because the cancer cells aren't clustered in a solid mass. Instead, various therapeutic approaches are used. One method involves harnessing the immune system, which can recognize and attack the cancer cells. However, leukemias and lymphomas can deceive the immune system, preventing it from attacking the cancer. To counter this, the corrupted immune system can be destroyed with radiation and replaced with a new one from a donor through bone marrow transplant. Another treatment blocks the deceptive signals from cancer cells, encouraging the immune system to attack the cancer. These drugs are known as checkpoint inhibitors. Scientists are also developing techniques to extract immune cells from the body, engineer them in the lab to target cancer cells, and reintroduce them into patients. These enhanced immune cells are called CAR T cells, and they offer an effective treatment option. By delving deeper into the biochemistry and genetics of blood cancers, scientists aim to create new personalized treatment options for patients. What are the symptoms of blood cancer? Blood cancer symptoms can be quite vague, which can make it a difficult cancer to diagnose. People with blood cancer may experience a range of symptoms, including weight loss that is unexplained, bruising or bleeding that's unexplained, lumps or swellings in different parts of the body, shortness of breath or breathlessness, drenching night sweats, infections which are persistent or recurrent or severe, then fever which is unexplained, that is like a body temperature of 38 degrees Celsius or above, rash or itchy skin that is unexplained, pain in your bones, joints or abdomen, which is your stomach area, tiredness that doesn't improve with rest or sleep, or excessive fatigue, paleness or pallor of the skin under your lower eyelid, where it looks white rather than pink, which it should look normally. So what are the kinds of leukemias? Leukemias can be broadly classified into two categories: acute leukemias and chronic leukemias. Acute leukemias are the most aggressive form, presenting with a very short history. Patients are generally very sick at the time of diagnosis and usually require immediate hospitalization and treatment. Now, on the other hand, chronic leukemias develop gradually over several months with symptoms that appear slowly. Patients with chronic leukemia typically seek outpatient appointments and are not as acutely ill. Understanding the differences between these two types is crucial. If you have been diagnosed with leukemia, you cannot compare your treatment to someone with chronic leukemia, as the treatment approaches can be very different. For chronic leukemia, treatment may sometimes involve taking an oral pill once a day. In contrast, acute leukemias require prolonged hospitalization and may necessitate a bone marrow transplant. A common question from leukemia patients is about the stage of the disease. Now, unlike solid organ cancers such as lung cancer or breast cancer, leukemia does not have stages. Leukemia is a blood cancer, and blood is a liquid organ that circulates throughout the body. Therefore, leukemia is present in the entire body from day one. This is important to understand because unlike solid cancers, where early stage cancers like stage 1, 2, and sometimes stage 3 can be treated primarily with surgery, leukemia treatment is always medical with no role for surgery. Leukemias are further classified based on the results of a bone marrow biopsy. Here, samples from the bone marrow, which is the factory where all blood cells are made, are sent for specialized testing. Advanced tests like flow cytometry and molecular tests helped determine the precise subtype of leukemia in an individual patient. These advanced diagnostics are crucial for determining the most suitable treatment and predicting how aggressive the treatment needs to be. Leukemias can affect patients of all ages, from infants to adults in their 80s and 90s. Fortunately, childhood leukemias are highly treatable. If a child is diagnosed with leukemia, it is a challenging situation for everyone involved, but the chances of complete cure are around 80 to 90% with timely modern treatment protocols. Therefore, there should be no delay in diagnosis and treatment. Now, the treatment goals can differ in older patients, often due to other comorbidities. Treatments like bone marrow transplants, which are required for a cure, may not be feasible. However, there are drugs tailored for this population that, while they may not cure, can effectively control the disease, improve the quality of life, and prolong life. The path is not easy, but leukemia is not always a death sentence. In the past decade, the drugs and modalities used for leukemia treatment were often extremely toxic, causing severe side effects. This has changed and continues to evolve rapidly. Now we have immunotherapies and targeted therapies that make treatment less painful. There is a lot of scientific progress in this field, offering hope for better outcomes. Please share this video because knowing the symptoms and treatment options available saves lives. Now, as always, I would love to hear from you. What would you like to know more about? Let me know in the comments below. So, okay, that's a wrap for this video. Take care, have a wonderful day, and I will see you again very soon.